Ladies and gentlemen, our guest speaker, Dr. Gbonjubola Abiri. Gbonjubola Abiri is a consultant psychiatrist, lecturer, managerial psychologist, professional speaker, and the CEO of Ready-Med Consulting Services. She's the co-author of 2 books, Mental Health in the Workplace and Handbook of Forensic Mental Health in Africa. She's a fellow of the West African College of Physicians, a member of Nigerian Medical Association, the Employee Assistants Professional Association, and the American Psychiatric Association, and has received training from the King's College London, the University of Washington, and the prestigious Harvard University, USA. Gbonjubola is a mental health advocate who is driven by the holistic view to health, using illustrations and indigenous language to reach our audience with content that drive mental health awareness, education, and empowerment. She currently runs a cartoon column in The Guardian Life Nigeria, On the Couch with Dr. G, and additionally uses her knowledge in psychiatry and psychology to influence and maximize effectiveness and productivity in the workplace via the Employee Assistance Program. She's the director, Women's Mental Health at the ASIDO Foundation and a faculty member of the Lagos MIND. She works with the THR Media as a sexual and gender-based violence advocate and currently serves as the member of the Global Advisory Council of Joy, Inc. Ladies and gentlemen, please welcome to Fertility Conference 2023, Dr. Gbonjubola Abiri. We celebrate you.
Good afternoon, everyone, and welcome to the 2023 Quiverfull Fertility Conference. I am Gbonjubola Abiri, and I am a consultant psychiatrist, a lecturer, and a mental health advocate. I'm also the CEO of Ready-Med Consulting Services. Today, I will be speaking to you on the topic mental health and infertility. Is there a correlation? Over the years, infertility has been a struggle faced by many couples. What we found, however, is that the blame is almost always put on and borne by the women. Interestingly, even with the advancement of science, many times the woman still takes a hit and takes a bulk of the blame. What we've also found is that while there are many ramifications and implications when infertility does happen, there are physical implications, financial implications, social, intellectual, environmental, even spiritual. Very importantly is the fact that infertility as an issue can affect people regardless of their age, gender, or socioeconomic status. And so it can become a leveler regardless of who it affects, when it affects them in their lifetime. I think it's also very important because as humans, we look at bearing children as, very culturally and religiously relevant. It's often seen as a marker of success. In the olden days, people always looked at how many children you had was attributed to how rich you were, how many children you could take to the farm. And so even in this day and age, having children is something of significance that people love, admire, and definitely look up to when they do get married, or even if they decide to be single parents. The landscape is, however, changing. But regardless of that, because of, the stigma and discrimination that comes with topics like mental health, the mental health of individuals or even couples who have struggled with infertility continues to be a major challenge. When we talk about mental health, quite a number of times, people look at the disheveled man or woman on the street, the person who is under the bridge for days, months or on end, not getting care. But what we've come to realize, again, is that every one of us has mental health. Mental health is often an abstract concept to most people, but mental health is actually the health of the mind. And all of us have mental health. What we all do not have is mental illness. When we say that an individual is mentally healthy, what we mean is that that individual is able to successfully perform the functions of the mind. Now, the functions of the mind are the functions of thought, emotion, cognition, perception, feelings, and behavior. But beyond being able to successfully perform these functions, It's also worthy of note that the individual must be able to have thriving relationships with themselves and other people, cope with the normal stresses of life, engage in productive activities, and contribute their own quota to the environment that they live in. If and when an individual is able to do all of these things, we can effectively say that the individual is mentally healthy. Infertility, on the other hand, is often described as the inability of a couple to procreate after having regular, uninterrupted, and unprotected sexual activities for a year. The WHO, however, draws it up to a 2-year period. When a woman also has or suffers from repeated miscarriages, it's often also referred to as infertility. Now you may ask, what is the link between mental health and infertility? They seem like two separate concepts, but in all honesty, they are very interrelated. And so when we talk about that relationship, we'd say that the relationship is bi-directional, in the sense that mental health or illness can lead to infertility, while infertility can also cause mental illness or affect mental health. And so how can mental health or illness lead to infertility? A couple or the partners who feel very unsettled, are under a lot of stress, feel depressed, anxious, or have any other mental health problem may actually not be in the right frame of mind to think about, the activities that lead to getting pregnant. Or even if they are engaged or involved in, therapeutic procedures where they need to get fertility management, they may not even feel well enough or feel, mentally capable to take those treatments. And so that's how the state of the mind can affect whether or not an individual is fertile or infertile. On the other hand, infertility is a big issue, a big deal. And of course, when it happens and it affects people, people who have many times would say that, oh, doctor, I kept myself. Doctor, I waited for this time of my life. Doctor, in-laws are saying all sorts. The stress, pressure, the overwhelming nature of that journey can actually impact negatively on the mental health of a couple. And so usually people would, respond with things like shame. They would isolate themselves. They will withdraw. They will feel disdain, even when people do not say anything to them. And very often than not, the environment that we live in is one where people feel like they should say something about a couple who hasn't, come forth with a child. And so you hear open comments like, what are you waiting for? Oh, it's been 9 months. Oh, it's been 2 years. Oh, it's been 10 years. Is it that God hasn't answered your prayers? And so the pressure is a lot, and the pressure continues to get worse. And so what we find, again, is that infertility can cause mental health challenges for people. When I started earlier on, I had spoken about how a majority of the pressure is borne by women, because women are the carriers. Very often, men are often left behind. But of course, infertility can be caused by male factors and female factors. And so because the pressure will continue to increase, you would see mental health conditions like self-esteem issues, confidence problems, depression, anxiety being one of the commonest mental health disorders when it comes to, infertility. You'd also see conditions such as eating disorders, sleep disorders, sexual disorders, sometimes personality disorders, psychotic disorders, and in a bid to cope with the overwhelming nature of all the stress, the pressure, the hassles, sometimes people turn to substances of abuse. And those substances of abuse can be as little as alcohol, cigarettes, marijuana, cocaine, and other illicit substances, to mention but a few. On the journey to becoming fertile, it is a journey because no one fully arrives. And so on that journey can actually be a very lonely journey. Largely because people who struggle and suffer from infertility feel like there's no one to trust, there's no one to talk to, and no one truly understands. While it can be a lonely journey, it's also very rewarding and reassuring to reach out to a community of like-minded women and men who will understand your journey and who will hold your hand as well. It's also very pertinent that couples walk this journey together. It's never an easy journey to walk alone. It's not a journey where we should trade blame or own blame. And so if the blame is not coming from other people, we should also try not to put the blame on ourselves as well. We shouldn't be critical of ourselves if we are on this journey of infertility. The good thing about the here and now is that a lot of treatment options are open for men and women who may have struggled with infertility over the years. But before you even start looking at treatment options, it is important to heal your mind. Because if your mind is not in a good place, your body will struggle. If you tell yourself that this journey is one that has happened for others and that it can happen for you as well, it's a form of positive psychology, a form of self-affirmation, and a form of you encouraging yourself that it can happen to you and for you as well. And so, reach out to that rich community, the community that has not just your gynecologist, but your spiritual leaders, your clinical psychologist, your psychiatrist, as you try to find, solutions for whatever problems that you might be grappling with. Mental health can be affected when infertility does occur. Infertility can happen when people struggle with their mental health. But this is likely to be a topic of the past if we give it the much needed attention that it very much deserves. I would like to end by saying that everyone listening to me and who might be on a journey of infertility is deserving. It can happen for you, but please get the right resources. Plug yourself to a community that cares for you. And most importantly, remember that there is no health without mental health. Thank you.
Go back to mental health. We were trying to get a question in for Gbonjubola Abiri concerning prepartum depression and postpartum depression, generally depression associated with fertility. Yes.
Okay. All right. Well, thank you very much for having me. And to the other speakers, too, fantastic job. And to Quiverfull as well. And to everyone on the call, thank you so much for coming on. Depression, again, it's a term that quite a number of times we use rather loosely. Some people use, depression to refer to just being sad, unhappy. But what we always say in my own line of work is that to make a diagnosis of depression, it means that the symptoms have been persistent, increasing in severity, and of course, affecting the individual's ability to work or function as an individual or in the community that they live in. And so, yes, women especially are at higher risk of developing depression. When I'd, my video, I'd spoken about how it is that on the infertility journey, women bear a huge bulk of the issues that have to do with infertility. Some men do, but more often than not, we find out that it's the women that bear the bulk. And so whether or not it's on the journey to fertility or postpartum depression, because I know that a question had popped up about postpartum depression. Postpartum depression is the depression that happens after giving birth. And so usually people would, expect that, the birth of a baby should bring joy, it should bring happiness, it should bring nothing but, it's what you've been looking for. So many people are looking for this gift, but for different people, it's different. And so postpartum depression can develop within the first 4 to 6 weeks after delivering a baby, sometimes as long as 6 months, and even sometimes even as long as 1 year. Usually when there's depression is a mood disorder. And so what you find is that the individual who is depressed has persistently low mood. The mood is low. The mood is not excitable. Regardless of what you say or you offer this individual, the individual just feels like, there's a huge weight on their shoulders. Apart from the mood, the energy is low. The interests are low. This kind of people wake up in the mornings. That's on the nights that they get sleep, just feeling like, life is not worth living. And so apart from the mood, energy, and interest, it's the fact that these individuals also have a negative view of the self. They think that, who am I? What am I? There's nothing here in this world for me. Negative views of the self, negative views of the world. Oh, this world is such a wicked place. This world doesn't like me. No one likes me. No one is on my side. And negative views of the future. Or the future is not going to hold anything for me. Maybe I shouldn't even be here. And so, of course, many times we also find that this people who may get depressed, and again, it's not only women who may get depressed, even on this journey to fertility, even the men can get depressed. people who are depressed may also start to think of, harming themselves, causing harm to not just themselves, but even people around them. They, apart from ending their own lives, they may start to cut themselves with sharp objects. They may also start to take illicit and illicit substances. So even, prescription medication, you find people just popping pills, sleep pills, pain pills, injecting themselves even when they don't have the expertise to do so. And apart from that, people can also turn to alcohol and other drugs that we know around us. Apart from this, of course, the individual may feel worthless, helpless, hopeless, and nothing that people say may even reach them or register in their minds. And so, of course, it goes back to, the conversation about how it is that people who are going through this journey do not need to walk the journey alone. And so whether you know someone or it is you who is going through this journey, I understand that it can be a difficult journey to be on. It's a journey where you need not just yourself, because it will test your patience, it will test your resolve, it will test your state of mind. And if you don't have it all together, because the condition will test you, you can actually break down. How is it that you can support someone who is going through such a difficult time? The truth is, have time for them. And creating time for them may be also difficult because every one of us has our own busy lives. But let's make them a priority because they are a priority. When we do make them a priority, we would create time for them, create time to listen to them, not to hear what we are saying, but what it is that they genuinely want to tell us. We must validate how it is that they feel. Don't tell them, oh, it's happening to everyone else. Why is your own different? Their stories are different. Their stories are genuine and their stories matter to them. We must ask them questions and not just assume. Ask them how they're feeling. Ask them what is going on with them. Don't look for clues or ask leading questions. Don't overwhelm them with, sometimes just encouraging. Sometimes just keep quiet and let them speak to you. It's very important that you shouldn't minimize their condition. And so don't invalidate what they're saying. Don't say that, oh, you've just waited 2 years. Oh, I know somebody who has waited. Nobody wants to hear that. Don't compare their journey to yours or someone else's. Take their journeys as unique, and unique it is. And even when you want to share from your own viewpoint, be sensitive when talking about your pregnancy, someone else's pregnancy, or other people's children. Be honest, give them space, but be thoughtful as well. Check in with them regularly, check in on them regularly, encourage them, pray for them, even when you are not there. Lead them to support, point them in the right direction. And last but not the least is that you must keep them involved in the process of your own life. Isolation is one of the things that happens when people are going through this lonely journey. And so they feel like, well, everyone else has moved on. Oh, my friends are already, their children are already in secondary school, they're already in university. Your own time will come. And so as we try to support them, we must keep them involved. Don't exclude them from your own details, not because you're trying to gloat or because you're trying to boast or show off, but because you also don't want to leave them behind. But most importantly, be sensitive and let them know that you are there for them and you are willing to hold their hand. It's a long journey. It can be a difficult journey, and no one should walk this journey alone. Thank you.
Thank you. Thank you so much. As in, I love how you said it. A lot of people, when we hear stories, and I always fight this particular one you said with my husband. I'm like, if I say I'm tired, don't tell me you had a busy day. I am tired. Just accept my tiredness as my tiredness. Don't compare. My tiredness and your tiredness are not in competition. So at no point should we start battering on who is more tired. And that also applies to those who are going through fertility journey. Some people have waited for 2 years and you waited for 20 years, but the mental health state of the two-year-old person in the journey is horrible. And they say, you just 2 years. Me that I've been waiting for 20 years. Hello, that's not the conversation. The conversation should always be that empathize with them, no conversation, no competition. Don't remind them of your auntie that also waited for 20 years and later adopted, or your sister that waited for 10 years and finally adopted. Just go and adopt. If you don't know anything to say, just tell them I'll be praying along with you and direct them to a professional. And if you are also that person on the receiving end of all this negative comments, people just not getting how you're feeling, I want you to also empathize with them, because really they are only giving based on what they know. And if they know better, they probably will be able to help you better than what you're going through right now. The women get the information, but how do they deal with their spouse who doesn't have that same information, especially when it comes to unexplained infertility? How do we deal with the mental health of our partners, and how do we manage that part of our relationship?
All right. Well, thank you. I'd like to thank Uju for, attending to the question prior to my attending to it. And, to add to a lot that she has shared is the fact that, yes, pressure is usually on the women, especially because when I spoke, I'd spoken about how it is that women are the carriers. Women are the ones that people see as, bearing the seed, who carry the pregnancies to term. And while they're dealing with their own, mental health issues, they also have to manage their own, spouses as well. And so many times men may seem left behind because many times men see themselves as providers. I provided this, so there's nothing wrong with me. It's you that there's something wrong with. You should be the one, going to the hospital regularly. Uju also raised a very pertinent point about how it is that many times men struggle, but because we're in environments where men are not, encouraged to cry, we say that, oh, man up. People can't see you crying. You're the man. You should be the one, showing a lot of courage and strength and resolve. And so many times you won't see men showing their real faces. Men just, brave it all. They show up. But the truth is, while women take a huge hit, a huge brunt of the issues, men also suffer. Men also suffer from, anxiety. They suffer from depression. They suffer from self-esteem issues. They suffer from confidence issues. It affects their work. And in supporting their spouses too, they're also affected because many men have to deal with, women who cry every month when their period shows up, women who cry because, all the monies that they've spent is not yielding results.
Drop the question on our YouTube page right now. The question is around the fact that how do you carry a pregnancy that the egg is not yours? So, what's the emotional? How would you be able to carry such a pregnancy? Do we have Gbonjubola to help us answer that question right now, or Mrs. Abago, you would like to take that?
Okay. So this question is around how do you feel the connection to the egg, or what? Really, I mean, a pregnancy is a pregnancy, How do you know? Okay, for instance, let me ask the question. If you do IVF and they actually use someone else's egg and you're not aware, would you carry the baby? You will carry it. I don't think it's a big deal. I've seen several cases of donor eggs. There's no difference, really. There's no difference. Again, I don't know, maybe there is, maybe Dr. Gbonjubola can help us associate or tie it to mental health and all that. But I mean, I did IVF several ones, which didn't work. If it had worked, would have been donor egg. I would have, gladly carried it. For me, it doesn't make any difference. Yeah. I mean, we adopted, wasn't a big deal. So I don't think there's any difference in using your egg, carrying it. You carry it and your body the pregnancy hormones will kick in as soon as implantation occurs. Every symptom that a pregnant woman, okay, the Uju is here, she can help us expatiate on that. How do you carry a pregnancy that is not your egg? You carry the pregnancy, you feel all the symptoms, you breastfeed the baby, you give birth to the baby, that's it. That's it. I don't see that. I don't think there's any specific criteria or ways or points to give to this is how to carry the baby. Over time, you will get just the same way that you foster kids. I've fostered a child before. You foster a child, and the day the child is going, you start to cry. Because you're connected. There's something. Of course, I know we're different. People are different, but I've fostered a child before, and when the mother came to take the child away, it actually broke me. It was really painful. And I remember one of those days I visited because they were relocating to South Africa. I went to South Africa and I saw the child. The child was already connected to me as well. When I was leaving, she started crying. She wanted to go with me. She was already in her was like 12. So it wasn't like she didn't recognize her biological mother. So there is a connection with the baby that you carried that you didn't carry in your womb, not to talk of the one you carried in your womb. There's no difference, really. That's the way I see. Dr. Gbonjubola, do you want to help us, or do you want to help us talk more about that? I believe that the body would agree, and as soon as the implantation occurs, your breast will get fuller, you'll be able to breastfeed the baby. Everything that a pregnant woman feels is what she feels.
All right, well, thank you very much. I totally agree with you, Catherine, on the points that you have made. But I think that the most important thing that most women or most couples who are looking at either adopting a child or going through IVF or doing surrogacy is to ask yourself why. Is it your personal conviction, or are you doing it because the pressure from outside is more? The truth is, if it is something that you have decided to do, you understand why you have decided to do it. And you also are, mentored into understanding that there will be challenges on this journey, including emotional challenges where you may feel detached from the child. The honest truth is that even women who go through pregnancy, labor, delivery, some actually have, attachment problems where they don't even feel attached to the children. And so the question on, postpartum depression earlier on is one where we find that sometimes women who actually went through all of these stages may actually feel detached from their children. And so ask yourself why. Why have I decided to go on this journey? Why have I decided to go on this journey? Why have I decided to choose the process I have decided to choose? What do I want? Do I want a child? Do I want a lifetime relationship with this child? Do I want it to, fulfill my own destiny, or to also, bring joy and happiness to not just myself, but to the family as well? Do I also want to nurture this child? Do I want to see this child go into someone very important? You need to ask yourself why. When you carry a pregnancy, in whatever way it's been assisted, your body will undergo some changes. The changes can be, physical, chemical, emotional. The changes are different at different times for different people. Depending on the challenges that you face, the challenges that you face may also make you feel like, well, I'm feeling detached from this child. I really don't want to, get too used to this child. At the end of the day, I honestly believe that it has to do with your thought pattern, which is why we're going back to the state of the mind. As a man thinketh, so is he. And so whether you think that you can do it right or you can't do it right, you are right at the end of the day. So think about it. Understand your why. Why do I want to start this process? The other process is to also think about how you want to nurture a fulfilling, thriving, and productive relationship with this child. When women are pregnant, they're encouraged to do things like, hold your bump, speak to your baby, read to your baby. It's a lifetime journey. Sometimes you may seem like you get it right, and sometimes you feel like, I messed it up altogether today. But it's a journey. It's a learning process. And it's a learning process, again, that you do not have to go on your own. It's the reason why, and I'm very happy with the conversation at Quiverfull, that conversations as per speaking with counselors are done early enough. We're not going to wait until the baby has come and the woman is like, wow, there's a new life. What am I supposed to do with this new life? No. Pre-pregnancy, intra-pregnancy, post-pregnancy, women, couples, men, everyone needs support. And in that support, of course, you will be able to learn what to expect, how to do things better, how to go on the journey more seamlessly. I also want to say that behavior can be learned. And learning behavior means that we understand that it takes effort. Successful relationships don't just happen, including relationships in marriage, relationships in friendships. Relationship with a child also takes a lot of work that would need you to nurture it, need you to learn about it, need you to empower yourself. And so, regardless of where you are on your journey, I would encourage you, equip yourself with knowledge, ask questions, read about whatever it is that you're going through, read about what it is that you want to get yourself into, ask your professionals pertinent questions. Let it be that you ask a lot more questions than, I didn't even ask questions when I was, going through this phase. And so again, for different people, the journey will be different, but treasure your own journey. Understand your own journey. Understand that the journey may not be smooth every day. Once in a while, it may come with bumps, but regardless of what it is, count it all joy. Count yourself, fortunate to be on this journey, to be thinking about it, and to be thinking about a process about how it is that you want to bring forth a child. Most importantly, like I said earlier, you will need that support. But that support will mean nothing if your mind is not in a good place. And so please, by all means, get your mind in a good place. Seek help, ask for help, get help early. The journey will be more seamless when you walk with other people who are a part of your tribe. Thank you.
Thank you for joining us for Fertility Conference 2023. We hope to see you next time.